What to expect from CF newborn screening tests. When it comes to newborn screening for cystic fibrosis, or CF, parents often wonder what the process involves and what the results mean. This screening is a routine blood test that takes place within the first few days of a baby's life. Typically, a healthcare professional will take a few drops of blood from the baby's heel, or, in some cases, from a vein. This blood sample is then placed on filter paper and sent to a laboratory for analysis. The main substance that the lab measures in the blood is called immunoreactive trypsinogen, or IRT. IRT is a protein produced by the pancreas. If the levels of IRT are elevated, it may suggest that the baby has cystic fibrosis. This is because CF affects the pancreas, leading to increased IRT levels in the bloodstream. However, it's important to note that high IRT levels can also occur due to other reasons, such as premature birth or a stressful delivery. Therefore, the screening test alone cannot diagnose CF. If the IRT level is high, a second test is usually performed. This second test often involves genetic testing to look for common mutations in the CFTR gene, which is responsible for cystic fibrosis. The process of newborn screening can vary slightly depending on the state. Some states use a two-step IRT test followed by DNA testing if needed, while others may perform one IRT test followed directly by DNA testing. If the results of the newborn screening come back positive, meaning there is a high IRT level and at least one CFTR mutation, this indicates that the baby might have cystic fibrosis. However, this is not a definitive diagnosis. Follow-up testing, including a sweat chloride test, is necessary to confirm the diagnosis. The sweat test measures the salt concentration in sweat, which is typically higher in babies with cystic fibrosis. Parents can expect that the screening test itself will cause only brief discomfort to the baby, similar to a heel prick or blood draw. While this may cause some crying, the procedure is quick. It is crucial to understand that newborn screening is a screening tool, not a diagnostic test. Many babies with positive screening results may be carriers of cystic fibrosis, meaning they have one gene mutation but do not have the disease. Additionally, false positive results can occur. Early identification through newborn screening is beneficial as it allows for earlier treatment, which can improve lung function, nutrition, and overall health outcomes for children with cystic fibrosis. If your baby's screening result is out of range, your healthcare provider will reach out to discuss the next steps and arrange for confirmatory testing. In summary, cystic fibrosis newborn screening tests are designed to detect early signs of the condition through blood tests that measure IRT and genetic markers. They are safe, routine, and critical for early diagnosis and management, but follow-up testing is essential to confirm any diagnosis.